Welcome to our channel, specialized in Prometric exam questions for Gulf countries. If you are preparing for this exam, you have come to the right place. We provide previous exam questions, frequently asked questions, and detailed solutions, along with logical explanations for each answer to help you gain a deeper understanding of the concepts and correct choices. Our goal is to simplify information and provide effective strategies to ensure your success in the exam. We will be uploading a new episode every 2 days, so stay tuned for more tips, practical examples, and in-depth question analysis. Do not forget to support us by liking and subscribing to the channel and activating the notification bell to stay updated. Let's get started with today's question.
The main cause of serial extraction is the primary extraction of A. C. B. D. C. 4. D. 5. Due to the narrowing of the lower jaw and dental crowding, we resort to serial extraction, starting with the primary canines at the age of 8 to 9 years. After 1 year, the first primary molars are extracted. Head and neck nevi with multiple lesions is A. Peterson-Kelly syndrome, B. van der Woody syndrome, C. Eagle syndrome, D. Albright syndrome. Albright syndrome is a genetic disorder characterized by multiple nevi on the neck and head in the form of patches known as café au lait spots. It is associated with growth problems, short stature, hormonal disorders, early puberty in females, fibrous dysplasia of the bones, and bone deformities. Seven-year-old with thumb sucking, how to start treatment. A. Consulting, B. Psychiatric, C. Orthodontic, D. Nil. Thumb sucking at the age of 7 requires psychological consultation. However, at the ages of 5 and 6, it is considered normal but requires habit-breaking treatment, such as a Holly appliance or a tongue crib. A 4-year-old patient visits your hospital after a bicycle accident. In clinical examination, you found the primary tooth intruded into the permanent follicle. What is the effect it will cause to the permanent tooth? A. Dens and dentae, B. Dens evaginatus, C. Turner's hypoplasia, D. Ankylosis. When a primary tooth becomes embedded in the follicle of the permanent tooth, it can cause damage to the enamel or affect the development of the permanent tooth. This leads to enamel hypoplasia in the permanent tooth, known as Turner's hypoplasia. A child with caries in the incisors. We call this caries. A. Rampant caries, B. Nursing caries, C. Children caries, D. Arrested caries. Bottle caries are commonly found on the upper incisors due to prolonged milk contact with the teeth, whereas the lower incisors are less affected due to the protective action of the tongue. A child comes to your clinic after fall down from stairs. During examination you have found the child has teeth which have no mobility but have luxation. Best treatment is A. Acrylic splint. B. Flexible fixation. C. Rigid fixation. D. No need for treatment. In the case of tooth avulsion without mobility, the treatment involves flexible splinting to prevent ankylosis. Rigid splinting, on the other hand, is used for complete tooth avulsion and jaw fractures. An acrylic plate is used to treat occlusal issues and bruxism. Mixed dentition period in children occur in between the eruption of following teeth. A. First permanent molar and canine. B. First permanent molar and premolar. C. Canine and second permanent molar. D. First permanent molar and third molar. The mixed dentition period begins with the eruption of the first permanent molars at around 6 years of age and ends with the eruption of the first premolars at 10 to 12 years of age. After that, the permanent dentition follows.
Do you find Arabic subtitles helpful? Let me know in the comments. Like and subscribe so we can keep going.